Good afternoon. My name is Elijah Sprague, and I'm going to be conducting my part of the presentation through this screen share today. Now, when we're talking about institutional review boards, it's important to get some clarification on its history, thereby highlighting the relevance of its existence in today's practice. Now, like most presentations, I'm going to begin this presentation with a quote. And that quote is, "It's more important to know what sort of person has the disease than to know what sort of disease a person has." Now, anybody want to guess who said that? Well, that was stated by none other than Hippocrates himself, living about 460 to 370 BC, over 2,000 years ago. Now, these principles were so important and they were so cutting edge for that time that they continue to resonate even in today's medical practice, insofar as doctors and physicians have to essentially swear an oath to these principles provided by Hippocrates over 2,000 years ago, highlighting the importance of an ethical standard known as primum non nocere, which translates loosely to "first do no harm." Now, again, these medical this oath lays the foundation of a lot of medical practice and research to this day. However, despite this Hippocratic oath, which has been going on at least in the United States for over 100 years, despite this Hippocratic oath, there still has been global incidents of human catastrophes where this Hippocratic oath was not followed, even by practicing physicians who swore an oath to primum non nocere. Case in point, the Nazi concentration camps. You had physicians like Joseph Mengele and Horst Schumann, who carried out heinous acts of experimentation on unsuspecting children and adults stationed in the concentration camps. Now, of course, these war criminals were eventually tried. I think some of them actually escaped to South America. But the war trials that took place after those heinous crimes and experimentations were carried out in the concentration camps eventually resulted in the establishment of the Nuremberg Code. Now, this Nuremberg Code was very, very important because it was one of the first times where citizens got together and they started establishing what some of the ethical principles that should be considered whenever working with human beings. And one of the primary components of that Nuremberg Code in 1947 was informed consent. You have to have consent. The person that you're operating on or researching, they should be given proper consent. They should know what they're getting themselves into whenever they're being studied or practiced on, so to speak. Now, even though these Nuremberg codes were established, there continued to be malpractice even in the United States of America. I'm sure you all have heard about the Willbrook study in 1956. This was very devastating. A group of scientists from a prestigious college university were injecting, I believe, the hepatitis virus into mentally impaired girls in a school. And then not only that, but you also had the Tuskegee syphilis experiment carried out through 1932 into 1972. Finally, you had the Fernald State school trials, which injected young boys with radioactive isotopes. This was carried out by Harvard and MIT universities. So again, prestigious schools, despite the Nuremberg codes, were still carrying out these horrible crimes on unsuspecting victims. And of course, we had the thalidomide case, where doctors began prescribing an experimental drug that was very popular in Germany and other parts of Europe. They began prescribing it on a mass scale to pregnant women who were experiencing pregnancy symptoms of nausea. As it happens, this drug resulted in thousands of children being born with birth defects, including loss of limbs, arms, legs, things of that nature, ocular deformities, etc. Eventually, the Carver-Harris amendments in 1962 required doctors to gain informed consent for experimental drugs. Now, the importance of this, now remember back to the Nuremberg trials, the importance of these Carver-Harris amendments in 1962 was this was the first, this was pretty much the beginning stages of those very codes that were just kind of acknowledged by the medical community. This was the first time where these ethical principles started seeping into actual federal legislation. Nuremberg codes began to be codified into actual legislation by the Kennedy administration. So this is the first time that we actually started seeing like these informed consents being required of patients who are receiving experimental drugs. An important tidbit, though, informed consent. Physicians still had the ability to deny informed consent to the patient if they deemed it necessary. So that still placed a lot of the power into the physician's hand, but it was still a necessary step in the right direction. Now, eventually, the Tuskegee experiments and the public outcry from the thalidomide medications ultimately resulted in the 1974 National Research Act, which started including terms such as the Institutional Review Board. Ultimately, and I think it was like 1978, there was a publication of the Belmont Report, which established three main ethical principles, which included respect for persons, beneficence, and justice. Now, it's important to remember that this National Research Act, like I said before, was the first time that we really started seeing this institutional review board terminology starting to make its way into the public domain. Finally, in 1981, this is extremely significant. Title 21 of the Code of Federal Regulations, CFR Part 56, was finally established by the U.S. Registrar Office. Now, the significance of this CFR document is that it required the establishment of institutional review boards. It was no longer just suggested. This was pretty much a codification of the requirements of IRBs to begin being established by institutions that were conducting research. Now, one of the important factors of this CFR document was that it required IRBs to include more diverse individuals. Now, these IRBs required diverse races to be included in the institutional review boards. They required one individual who was a scientist, who had a scientific background of some kind. Also required one individual who was a non-scientist. And finally, one member not affiliated with the institution. This was usually a member of the community. Another interesting finding that I came across was that institutional review boards, to this day, are not required of institutions conducting research, which is a slightly unsettling thought. IRBs are only required, and registration of your IRB is only required if you are collecting funds from one of 17 agencies. And some of those agencies, I believe, include the FDA, the NIH, Department of Agriculture, etc. Basically, what we're trying to say here, or what I'm trying to say, is that the Institutional Review Board is of extreme significance. It protects human beings from harmful research being conducted. Now, these experiments are still being conducted today outside of our ethical standards provided by the CFR documents. So it's very, very important for us each institution that is carrying out human subject research to have their own IRB to ensure the health and safety of human subjects. Because as Hippocrates stated, it's very important to separate the person from the disease.